Hi everyone, and welcome to our Provider Education Network webinar. Today's webinar will focus on chronic care management and will be presented by Dr. Keisha Gantz. I'm going to turn it over to Dr. Gantz to tell us more about herself and her webinar objectives. Thanks, Dr. Gantz.
Thank you so much, Marcy, for that introduction. As Marcy said, my name is Keisha Gant and I'm a pharmacist. Today, I would like to speak with you about chronic care management. Today, we will discuss chronic care management, the pharmacist's role, and various ways a pharmacist can be included into a provider's practice. Now, let's discuss the definition of chronic care management, or CCM. Chronic care management encompasses the management of patients with multiple, defined as 2 or more, chronic conditions expected to last at least 12 months or until death, and that place the patient at significant risk of death, acute exacerbation or decompensation, or functional decline. Practitioners with the ability to pay may consider identifying these patients by using the definition above to query a list of potential CCM candidates. This slide contains some examples of the chronic conditions patients eligible for CCM may have. Please note that this list is just examples and is not a complete list of chronic conditions. There is no specified list of conditions. This list includes those highlighted by the Centers for Medicare and Medicaid Services, or CMS. The current state of chronic conditions in Louisiana lends to the need for CCM. In 2015, there were 2.9 million people in the state with one or more chronic disease, and approximately 41%, or 1.2 million of those people had 2 or more chronic diseases. This lends to the projected cost of chronic diseases in Louisiana from 2016 to 2030 to total $612 billion. Additionally, if there was better prevention and treatment of these diseases, 14,500 lives may potentially be saved every year. When Louisiana was compared to the rest of the nation, America's health rankings gave Louisiana an overall ranking of number 50. We will now discuss how pharmacists may assist with improving patient outcomes using CCM. CMS discusses various types of healthcare professions in its CCM regulations. Qualified healthcare providers have the ability to bill for CCM services. They must also obtain patient consent for services and develop a comprehensive care plan. Clinical staff are licensed staff who may assist qualified healthcare providers with various aspects of CCM. They must be directly employed by the clinician or the clinician's practice, or be a contracted third party and generally supervised by the clinician, no matter when the services are provided. This does not necessarily mean that the clinician has to be on the premises providing direct supervision. Before employing CCM services, practices should refer to the CPT coding handbook and their state scope of practice regulations before deciding which staff should provide CCM services. Pharmacists have the ability to assist with common challenges experienced at the clinician's practices. These challenges include medication-related issues such as responding to refill requests, prior authorizations, and medication therapy management recommendations. Due to the overbooking of patients, limited appointment times, and other responsibilities, it is difficult for clinicians to address their inboxes, focus on quality measures, counsel patients on lab results, and correct note documentation as a result of claim rejections. Pharmacists are able to support clinicians with these challenges. Now that we have discussed CCM and how the pharmacist can help, let's discuss ways to integrate pharmacists into a practice. CCM consists of 5 core activities, including recording patients' data in the electronic medical record, maintaining comprehensive care plans, and providing 24/7 access to care and comprehensive and transitional care management. Since 24/7 access can be provided by clinical staff not co-located with the clinician, this allows for 24-hour pharmacies to serve as a resource to help meet this CCM requirement. Additionally, pharmacies regularly interact with patients when dispensing medications. When planning to provide CCM services, clinicians should consider the workflow and roles of the various care team members. This chart illustrates the different team members and the services that they may provide. Notice the services pharmacists are able to provide are outlined by the red box. Once a partnership with the pharmacist is formed, or as it develops over time, qualified healthcare providers may consider granting the pharmacist more authority to address medication-related issues, such as making medication adjustments based on the parameters outlined by the healthcare provider through a collaborative practice agreement. Depending on the pharmacist's scope of practice, as determined by the State Board of Pharmacy, collaborative practice agreements may grant the pharmacist the authority to authorize refills, adjust medication doses, order lab tests, and other services that typically require authorization from a healthcare provider before performing them. Here is a list of CCM CPT / HCPCS codes with prices based on the physician fee schedule facility price for the rest of Louisiana with all modifiers. The CCM codes describing clinical staff activities are outlined by the red box. They may be provided by pharmacists under general supervision, meaning it does not have to be performed directly by the qualified healthcare professional, nor does the qualified healthcare professional have to be physically present when the service is provided, but it must be provided under the provider's overall direction and control. This slide illustrates the services pharmacists are able to provide to help providers fulfill the requirements for billing 20-minute CCM services. In summary, pharmacists may assist with monitoring the patient's conditions, providing education, communicating with patients and their caregivers, and providing or assisting with proper documentation. Atrium Healthcare, formerly known as Carolinas Healthcare System, is a healthcare organization that provides comprehensive medical services to its patients. They utilize CCM to facilitate population management. They focus on Medicare patients with uncontrolled chronic conditions and frequent healthcare utilization, such as hospital admissions. There were 8 regional care teams that consisted of pharmacists, nurse care navigators, and health advocates or social workers. The team used the electronic health record to document care plans, pharmacist notes, medication lists, the amount of time when communicating with patients, and other pharmacist functions. The time spent on the telephone by pharmacists and nurse care managers counted towards the CCM monthly billing time. And as you can see here, this is an example of the referral process that Atrium used for this program. So the results included that 25% of patients qualified for complex CCM billing or higher charges. There was also an increase in referrals that were attributed to physician champions. Outcomes contributed to the care team included reduction in readmissions and costs for patients with heart disease with a reduction of 25%, diabetes, a reduction of 45%, and COPD, a reduction of 45%. Another potential type of model involves a physician's office partnering with a community pharmacy. This is an example of such a workflow that outlines the roles of the physician's office and community pharmacy in providing CCM. In an ideal environment, the community pharmacy would have access to the provider's EHR in order to better facilitate information access and the exchange of clinical information. If this is not possible, an alternative would be for the provider to maintain an electronic care plan and share it electronically with the pharmacy, and the pharmacy to provide CCM information to the healthcare provider for inclusion as official documentation in the EHR. A study was conducted examining CCM services provided to Medicare patients with uncontrolled hypertension by a partnership of a family medicine clinic and a community pharmacy. Northeast Iowa Family Practice Center and Greenwood Pharmacy entered into an agreement to provide CCM for select patients. This agreement included a collaborative practice agreement to approve refills for and independently adjust medication dosages for antihypertensives as needed. The initiation of any new hypertensive medications required prior approval by a physician. Pharmacist interventions were documented in the clinic's EHR using a SOAP note template, and EHR medication lists were updated by the pharmacist as needed. An independent software was used to document the time spent providing CCM services by the pharmacy and clinic. This helped to determine cost sharing since it was based on billing minutes. 26 patients over 9 months received at least one community pharmacist intervention. The average patient was 70 years old, and 73% of patients were on 2 or more blood pressure medications at baseline. Results included an average decrease in systolic blood pressure of 7.3 with a p-value of 0.006, making it significant, and in diastolic blood pressure of 2.4, but it was not statistically significant. The total revenue over the study period was $5,842. Total revenue for the community pharmacy was $2,785, in clinic $3,057. This averages out to about $224 per patient, with approximately $107 per patient going to the community pharmacy and $117 to the clinic. Please consult these references if you would like to know more information about chronic care management. Additionally, for more information, please contact Wellahead at wellahead@la.gov. Thank you so much for your time and attention.
Thank you everyone for joining this WALPIN webinar. If you'd like to look into more trainings from WALPIN, please visit our website at www.walpen.org under Provider Education. Thank you.